Hello everybody, this is Katia at Cayenne Beauty Bar, and this is Dr. Dahdah.
Hello.
And I'm going to be interviewing him because many of you keep asking many questions, and I felt this video could be a little more informative of what we offer here. Okay, Dr. Dahdah, what do you do at Cayenne?
I am the medical director at Cayenne, meaning that I am in charge of supervising and also performing all the many of the procedures here, including the injectables, as well as the radiofrequency treatment, as well as laser treatments.
I'd like you to tell me a little bit, what is your training?
All right. My training is basically started after medical school. I went to Paris and I did a year of surgical anatomy, which has to date, I think, has influenced me in this field. And then I came to the US and I completed my internal medicine and nephrology practice, but I was always driven by the idea of interventional. I like to do a lot of procedures since residency, since internal medicine, and I decided to pursue interventional nephrology, which is basically dealing with dialysis patient vascular accesses. So I have that's my passion. Then from there in 2017, we opened Cayenne, and we had the training with the Biora company in reference to the IPL treatment, all the anatomy, all the physiology, with the radiofrequency. And as things were moving on along, so I decided to start training for injectables. And several of those trainings happen in conferences. A lot of them happen in the office, sent by the actual filler companies, that they come and they train you one-on-one several times, multiple times. And that's how, with experience, with time, I got all the knowledge I needed to pursue this. So combining all these experiences that I told you about before, that helped me with what I'm doing now. I also help with the aesthetic portion. I always like that field of medicine, which was not existent in the 80s and 90s.
And there's something, a fact that I want to tell you, is that when we met originally, I already was in this field, and I started really when I was about 19 years old, meaning I have 40 years of experience. And we always had a dream to open something like that. Initially, that's why we went to France. It's like, this is always something, but life takes you to a different path. But now, at this age, we are doing what we always had dreamed to do together. And I want to ask you one more question. There's so many treatments out there, and there's always so confusing to all the clients. How do you choose what you want to bring to Cayenne?
I think very importantly is talking to the client. In medicine is listen to your patient. And I do the same thing. I talk to my clients. I think it's crucial for the physician or the practitioner to listen to what they want, what they are concerned about, answer all their questions, and then we decide together how to proceed. Normally I take one part of, I ask the client, what bothers you the most? What would you like to improve on? And they always have one concern, and then some other concerns may come later. That's what we'll dedicate the consult and the treatment for that specific issue. I think each client is different, and I treat them differently in the sense of what my recommendations are, what are the limitations of certain treatment that they think they want, but I tell them this is the limitation and we can do something else better. And they are almost always very open-minded about it because they see the results of our clients.
But I want to know, for example, there's so many brands of neurotoxins, so many different treatments out there. When we were deciding on our menu of what to offer here at Cayenne, why, for example, are you so much into the ECPRF gel, or why you would choose a neurotoxin like a thiamine or Dysport? What do you think the difference? Because it's so confusing for clients to know what is the difference with the thiamine, Dysport, Botox. I mean, those are the questions.
Sure. In reference to neurotoxins, they're all made of the same botulinum toxin, different protein added for the transportation. And I like the thiamine. I tried them all. I think I basically like thiamine because it's a pure form of botulinum, and I think I've had a very good success with it. And also, I love too the Dysport. I think it's an awesome product. They tell you it lasts longer. I don't think so. The majority of them last 3 to 4 months max, and if you're an athlete, it lasts much less. But they're all similar products, and I feel very comfortable with them, and that's why I prefer them. My clients are the one who decide at the end, and they love those two products. I don't have a need to go and buy another product or another neurotoxin out the market because I feel comfortable with those, and the clients are very satisfied. In reference to the plasma is it's been used for many years. Actually, I think it was discovered by a surgical by a dentist, I think, in France, where he did it the plasma gel to improve on the bone grafting of when they were putting implants. But I listened a lot to in conferences, and I talked to Dr. Rajani about the plasma gel, and I started using it here at Cayenne. The technique, I had to learn it, obviously, and I think the results are beautiful because you're using your own plasma. It's natural, 100%. I don't add anything to it. Some people recommend if you want to add some lidocaine. I prefer not to add anything, not to contaminate anything. And the results has been awesome. It's what we call autologous filler, meaning your own body is the product. Basically, I remove the plasma from you, the blood, and we'll go through a process. And recently, over the last 6-7 months, I started doing the plasma gel. That basically it's a biostimulator. It stimulates your cell, your collagen, your fibroblast, all the inflammation cells, and you see the skin naturally rejuvenated. I think the whole texture of your skin improve. Sometimes it's honestly my favorite biostimulator or filler, an autologous filler for under eyes treatment. I think it's been awesome. I have several cases of severe under eye problems like atrophies and all of that, and I've used 2 or 3 times the treatment, and people love it. And that's in a nutshell what I think about it.
Well, I personally love the thiamine myself because I see myself going every 5 months sometimes.
Yeah.
Like I'm not an athlete, so I'm not working out that much, but I really like it. I want to know, what do you think is the overall best treatment for aging?
Well, that's a very difficult question because
Yeah, I know.
it's not only about neurotoxin, about fillers, about biostimulator. It's really how you take care of your skin, and that's where Katya plays a major role here. She is awesome with that. She really talks to, it's her passion. And I think that plays a major role in skincare. It's very important. I'm not saying that fillers, biostimulator, all of those don't work, but I think you have to take care of your skin. And there are several options that we have here at Cayenne. Is like indications for IPL or lasers. I've seen awesome results with radio frequencies. Treatment, actually medical equipment for radiofrequency. So we have Viora here, and we're very proud of it. And those treatments with certain nutrients that we apply to the skin, and we encourage clients also to take some nutrients, plus the fillers, plus the neurotoxins, and everything else work together But I know I have a lot of clients that they don't want to hear about skincare. They only want results immediately. But at the end, with time, they get convinced that something else needs to be done. When you tell that their skin is dry, has a lot of volume loss, and and sun damage, which we see a lot.
I personally find that that's why I'm so pro the skin. Like the skin has to have like one tone. I try to have a very no pitch. With the redness, with the little vascular, with the little pigmentation. I truly believe that fillers and Botox is not for everybody. That if you have a really beautiful skin, you can age so gracefully and look really amazing. I do feel like some tweaking here and there, and that's what my clients, I don't like to use like one here, let's do this one time. I like to go in stages, and that's something that we do a lot here. I want to know here, there's another question many of my clients ask, if there is a combination of treatment that work best.
I think this was just addressed. I think the combination of one of the treatments I love to do is, and it's awesome, it's combining the plasma gel or plasma with a filler. Regardless of what the filler is, it's awesome if you combine it with a biostimulated filler like the alpha, like for example, the Radiesse, which is alpha hydroxyapatite. That stimulates collagens, elastin, and also with the, I'm sorry, I'm looking at the products. The Sculptra also is a biostimulator. And I think the combination is beautiful. I've seen awesome results with the combination of those treatments.
My favorite, I'm gonna say, my favorite is the fractional with the plasma.
That's my second.
That's my favorite.
It's that combination of the fractional with plasma, which is radio frequency, with the plasma. We've seen incredible results. Outcomes. People are so happy with their skin texture and what it does. It basically removes the top layer of your skin in an organized radio frequency fashion.
Depending of what treatment I want to do, because when I do scars or like acne or acne scar, or if I do like for wrinkles, which is after 50, like it varies. Like
varies on the frequency, on the intensity of the frequency, and also on the level of.
So it's very customized. It's not for the same thing for the same person. So in doing it's not only the equipment, but it's also the experience, the person managing the equipment that it has in order to have the results that you're looking for. And
for which we were trained very thoroughly.
And we've been on this I personally been in this one.
And we always go to conferences and learn
Constantly.
more and more and more and adjust what we know with new technology.
I want to know, many people want to know about prices. So what is the price range for Botox treatment or neurotoxin depending on unit?
Well, that's also very personalized treatment. So the price of a Xeomin or Botox or the Dysport, it's really, everybody has similar prices, plus minus $1 to $2 per unit. We're on the lower end of it. We use the same product like everybody else, but in this practice, what we do is we treat the patient appropriately with the specific amount. We don't overdo things to overcharge. I think that's crucial. I've seen a lot of people that they visit us and say, oh, but I was given much more than that. And I tell them, let's try what I'm telling you.
But
and we'll
it
see
can
the
be
effect.
dilute, and that's what.
That's something, but what I'm saying is, in general, everybody should be diluting their neurotoxins the same way. That's what the recommended dilution by the companies. And we do this here. But I don't know how other people practice or anything like that. But I tell you that our prices are very, very reasonable compared to others. I can't give you prices because it's not appropriate for me to talk about pricing at this point.
Well,
it's the amount is important.
The amount and how we do micro botox, we do like a little
Sure,
here,
a lot of more
but we
technology.
tend to go in the lower end, and if you need more, then we can apply more, but we try to go in the stages. Also, we know we get to know you and know the expectations that you have. And if you like movement, like I have a lot of movement,
Okay.
but because I like to have other people, they want to be frozen, and
Yeah,
that's fine with
and
me.
a lot of time,
I don't
a
like
lot
it.
of people who have been here frequently, I will know how many units they need because it's, I've been giving it to them. If I see there was something the person need to have a retouch, I can adjust all of that into when she gets it again with us. And that's the beautiful thing about keeping charting on everybody, any history, any information I need to know about the clients. As a physician, I will keep on file here.
I need to know, one of the other questions is from times that, what can I do for tightening in the face and body?
Well, if we talk about tightness of the face and body, it's we have to talk a little bit about nutrients. These are vitamins, collagens, supplements that we should be on, even vitamin D. But this is something that levels need to be checked, and I don't do this here. It's really uh, up to the primary care. A lot of people, I tell them, go please talk to your family physician and check your vitamin level, vitamin D, mainly, as it's crucial in skincare and every aspect of the body, including the immunity of the immune system also. If we start with nutrients and healthy nutrition, and we're not going to go about specifics, and also about uh, what we call the blanking out on that, about your background. Okay, your
Ethnicity too.
ethnicity is very important.
Yes.
I ask people, what's your ethnic background? And some people may confuse it with, I'm from Alaska, I'm from Virginia. I said, no, now with DNA testing, we know, a lot of us know where we're from and what background do we have. And that is very important. To me, is important because I show them features of people that they come here that they have Northern European background, which is incredibly common in this area. And you see the prominent cheekbones and prominent features that are awesome. So when we do treatment, we accommodate that. I tell them as a joke, you know how much money you're saving for having cheeks, like these beautiful cheeks and all
But
of
we
that?
also having a lot of sub-Saharan and
Yeah, sub-Saharan too. This is one example.
Uh-huh.
And also, the darker skin or African American skin is also very beautiful with very prominent cheeks, lips, and treatment changes between one and the other.
yes.
It really is very client specific. Everything we do here. A lot of people come, a lot of clients come, and they have in their mind, they saw a picture of somebody that they admire and they want to do certain treatment like threading or Botox. And we sit down, we talk, I'll tell them the effect of the threading, how will it look, and they say, well, that's not what I was looking for. So that's why discussion with the client is crucial. Also, the skin tightening is radio frequency is awesome, IPL is awesome. A lot of clients, I'll tell
Skin
them,
tightening.
for skin tightening, I tell them, before you spend money on Botox or on fillers that are very expensive, try to go with Katya and start that, or we can put to make them happy and look great, and that is not affected by the IPL or the radio frequency treatments, and the enhancement is incredibly nice. So it's not like one size fits all. It doesn't happen in aesthetic medicine.
Mm-hmm. I put it
In
for
medicine.
from my side for skin tightening that is not invasive like he does. I had different equipment. I mean, really, I cannot do it with a massage or with a specific cream alone. We have a rate of a skin tightening with radio frequency that goes all the way deep to the fat. And you know, when when you warm a piece of meat, and you know how it shrinks, so that's what happens. It tightens everything. Besides the fractional, I can do it with the skin tightening from Biora. ST, it's called BST. You can Google it. Also, I have another facial that contains dual frequency and 4 radios, the 4 frequency. So it's a lot of stuff that we can do with it. And also we had the body treatment for the, I mean, I have two kinds. We have the V form, and then we have the Evolve from Emote, and this also can tighten significantly. It reduces the circumference.
Yeah, the Evolve machine, in addition to that, which is awesome, none of the other machines do that I'm aware of. It tones your muscles, your abdominal muscles, or your tricep muscle or bicep. Yeah, it can build muscle and tone them, which is a lot of us don't do.
And this can be needed, like toning for, a person that is in an older age that is not overweight, but then they're losing mass.
Yeah, elasticity and mass.
Yeah, and that's really important.
Yeah. Yes.
Okay, tell me, what is another alternative for facelift?
That's again a very tough question. There are clients that we have told them, going to their expectation, said we're very limited. I tell them what we can do to avoid facelift, but they said they come and say, and they pull their skin back and everything back. I said that's facelift.
Yeah, and we don't mind sending guys, telling them like, okay, for this, what I think you need a facelift.
Yes, because you don't want them to lose their time and money here, and knowing that we cannot achieve what they're looking for 100%.
Even for the body, if they need a
tummy tuck. I send a lot of clients.
I'm like, and these are my favorite doctors. So I don't have that's why the consultation is so important, and for us to know what is your what your expectation is. Yes. I am 59. I haven't done any plastic surgery in my face. I don't say I will never do it because you know me. But so far I like to still recognize myself, and I noticed that it's very few who can do it like in a way. And I feel like today's technology allows us to do this because
to delay it.
Yeah, and the thing is like, a facelift, you're gonna continue aging. Even if you do a facelift, I mean, we always aging. So people always ask me, how many times do I need to come? This is one time over. Nothing is one time.
Yes, nothing. And a lot of times with the facelift, you always may need some fillers to keep up, because when they do the facelift and then I put grafting or what we call the fat transfer grafting, which does not last too long, you always need some neurotoxin and some fillers and plasma gel and all of those.
Tell me about that, the fasting.
I'm not too familiar with it. I don't do it, but a lot of people they transfer fat from whichever from.
Why you don't choose it?
I think it involves no, I like it, but it's a lot of involved technique, and I don't think it should be done in a place like ours. I think it should be done at a plastic surgeon's office, where they have all sterile rooms. Yes. Or I think I am the kind of person that I understand the procedures before I do them. I learn them, and I think I'm not saying that I will never do a fat transfer, but for example, liposuction in the office, I think is very doable, but and it could be done in the future in this practice. But I like to take things slowly and see what is the demand for everything in our area. We are in Newport News.
And we have everything disposable. I mean, yes, we don't repeat anything. We are very sterile in our shop, and people can tell when they come in.
Yes, so everything is well kept, clean. The customer service here is awesome. The results are great. I really like when people actually during the procedure come with their face down, or they look like they're concerned about their appearance, and when I perform the procedure, whichever is threads or filler, their smile changes, everything changes, and the self-esteem goes up right away. I tell them, you see, now you're smiling. So, I love it, and they kind of.
I think I have one last question.
Yes.
I wonder why do you choose thread versus when do you choose a thread versus a filler?
Okay, the threads are normally for skin laxity. You want to lift an area of your skin, but you don't want to volumize it. I have a lot of clients that have awesome cheeks, or they have cheek filler and they don't want more filler, but their skin is still sagging, mainly in the mid face and lower face in the jaw area. And I tell them this is what we can do. I kind of pull on their skin to show them what will be the effect. And trust me, I don't exaggerate. I always tell them this is not what the expected result, but this is the minimum expected result, and they love it because it does the lifting and it produces regenerate the collagen from the area of the threads. And
What kind of threads do you use? Because
they
I
have a
personally had
lot.
a thread long time ago that I hated. It was done by
It's a bad
another doctor.
experience, yeah.
Yeah,
But I used like a
this
PDO
one,
thread, and it's an Italian one.
it's from Italy,
Yes.
and it's very
And
thin, like
yes, very
very.
thin. It's very awesome product, and I don't have to be pulling the thread like you see on videos and start tightening the skin. And some people don't tighten the skin; they cut it. Some other people do the put like a knot on it. I prefer the simplicity of this one, and the product is really good. It's called HDPDO.
And it's very, very thin. I love it.
Very thin,
Yeah,
yes. Use like
and because I don't want to look like too puffy,
Yeah.
and that's what that's why I like to do this.
And a lot of time, it takes time. The effect is immediate, but then it takes time to build the elastin and collagens in your skin with all these treatment. And
I want you guys, if you have any questions, please write it down at the end and make a comment and like our page, and let me know so we can answer you back to your questions. Again, we have a huge variety of treatments here that we can do it and show you, and there is a lot of before and afters on our Instagram and also on our Facebook pages.
sorry to interrupt. Also, our skincare products are really, really good. They're medical grade. People love them.
And I think
we
there
try
are
to keep
many,
it very
many good
simple.
products out there, but people really self-prescribe, and that's the
Yes.
problem. You really don't understand what is the reason why you're having this acne, or why is the reason. So we go to the source of what is the reason.
Yes, and a lot of time we tell them you cannot use this product because it dries your skin or produce redness, erythema, and we make the adjustment accordingly.
Okay.
And they love that. It's knowledge. It's about knowledge.